To our Weather Authority team in just a second, but we're going to take you live to Washington, D.C., where they are just about to set up a news conference with FEMA. And of course, we're anxiously awaiting what is going to happen there. There's Health and Human Services Secretary Tom Price on the left. Let's listen in.
Very similar to Harvey, there's a unified effort to lean forward to help our island partners as well as our CONUS U.S. state partners to achieve their response and recovery goals. Starting with the islands, the goal right now is to stabilize the Virgin Islands and Puerto Rico to make sure that we are addressing all life safety and life-sustaining issues, and we're in really good position to help them do that. There's great communication with both governors in the island communities, and the objectives are very clear. Emergency power and restoring power, life-saving, life-sustaining commodities, emergency communications, and security. So those are the goals that we are currently supporting. And this is a massive effort. Because of the logistical nature of being able to access islands, we are very proud to have our partners with the Department of Defense. They've provided over 6 different Navy ships in the area that will be operating today to help us accomplish, or help our island partners accomplish their goals. Moving on, obviously, Hurricane Irma continues to be a threat that is going to devastate the United States and either Florida or some of the southeastern states. This is a complex forecast. Anybody from Alabama to North Carolina should be watching this storm very closely. The forecast and the direct impacts of this storm have yet to be determined because, one, it's a very powerful storm, but the nature of the curve in that forecast after 72 hours is going to be the key to see who gets the worst impacts here. It's not a question of if Florida is going to be impacted, it's a question of how bad Florida is going to be impacted and where the storms ends up over the next 4 to 5 days as it passes inland. And I think it's very important to point out, anytime the center of circulation of that storm travels inside that forecast error cone, whether it's on the left-hand side or the right-hand side, it's a good forecast. And then you have to, add into that the maximum radius winds, how far out hurricane winds extend from that center of circulation. So that's why I'm saying anybody right now from Alabama to basically North Carolina needs to be monitoring and taking preparations. Obviously, there's a lot of evacuation activity taking place in Florida over the last 24 to 48 hours. Heed all local warnings. The goal is get out of a storm surge vulnerable area. That is wind-driven coastal storm surge flooding waters coming on shore. That's the most devastating hazard associated with hurricanes. Get out of that storm surge area and get into a facility that can withstand the winds. That doesn't mean you have to travel hundreds of miles to do so, but get out of the storm surge area into a facility that can withstand the winds. Later today, I know that other states are also considering evacuation movement. And the jurisdiction to ask for or call for mandatory evacuations may be directed by the governor or your local officials. So make sure you understand who issues that warning, why you're being moved, and take precautions. Obviously, Governor Scott has been leaning very far forward. We have been in support of Governor Scott. We're helping him to address the fuel issues. Yesterday, the president proactively waived with the Jones Act to be able to supply more fuel to help the governor get more fuel into his state. The president has been very quick to also issue disaster declarations in support of the response movements that are going forward, and we will continue to work with our partners. With me today is Secretary Price from HHS. Obviously, emergency management, as I've been saying, is a partnership. It's not only a partnership across the federal government, it's a partnership through all levels of government, all the way down to the citizens that we saw proactively step forward in Harvey. We're going to need that same whole community approach today, and with me is Secretary Price. I'd like to turn it over to him for a few words about health and medical issues.
Thanks, Brock. Anytime in an emergency, you want to make certain you've got the best people coordinating, and I can tell you that the American people couldn't be more proud of the folks at FEMA and the leadership that Brock Long and his team are giving. I want to share a few words about Harvey and then turn to Irma. In terms of Harvey, we remain in the response and recovery efforts that continue. The life-saving activities are transferring to life-sustaining activities. Still have about 16,000 people in shelter. From a health standpoint, there are 4 hospitals that remain closed. This comes down from a high of about 30 hospitals that were closed at the peak. About 13 dialysis units are closed, but there's capacity to accommodate all of the patients in the southeastern Texas area. 26 nursing homes remain closed, but again, the capacity has been able to handle patients who are moved from those nursing homes. HHS itself has had about over 5,000 patient encounters since the beginning of the storm there, and the vast majority of those unrelated to the storm itself, but needing to have attention and mostly minor health activities. CDC is working with the state to work on a mitigation plan for mosquitoes and the vector, and that is ongoing and will continue for days and weeks. Turning to Irma. In terms of the Virgin Islands, St. Thomas Hospital, the main hospital on St. Thomas, is closing. The critical patients have been evacuated already, and the remainder of those patients will be evacuated today, either to St. Croix or to Puerto Rico. And in terms of Florida, this, as Brock said, this remains a remarkably dangerous storm, and the window to get yourself in the right spot for weathering the storm, either evacuating or weathering the storm, is closing rapidly. Health and Human Services and others, along with FEMA's direction, have pre-deployed a number of individuals, either in Atlanta or southern Georgia, as well as in Dallas, preparation for moving into Florida as the need arises and as the local individuals in the state request. We have extended waivers so that medications can be provided for a longer period of time through pharmacies, and I would encourage individuals to take advantage of that. One of the things that HHS does is to identify those folks that are electricity dependent for their health needs. So whether it's folks on oxygen concentrators or those dialysis patients or individuals who have electric wheelchairs that they use in order to be mobile, we share that data. We provide that data to the states and have done so to Florida so that they can then contact those individuals directly. And there are about 5,400 dialysis patients that have been provided to the state, over 20,000 electricity dependent. And about 6,700 patients who are electricity dependent on oxygen concentrators. So I want to just echo the words that Brock stated about the governors leaning in. Governor Scott has been a remarkable partner in all of this. They have, along with the governors in Georgia and South Carolina, they've been very, very aggressive in making certain that they are getting the word out to their population. We're going to have a couple rough days here, a number of rough days, and whatever befalls us because of the storm, I can assure the American people that your federal government is working as diligently as we can to make certain we can respond to whatever needs arise. Thank you.
Thank you, Secretary. So just to recap too, right now we have nearly 8,000 federal government staff members forward deployed, and we also have commodities. You'll see the force lay down here on this map. I know you might not be able to read that, but basically for Irma specifically, we have commodities staged from Alabama all the way to North Carolina, and actually we are going to be running commodities out of New Jersey to support the U.S. Virgin Islands as well as Puerto Rico later today. Citizens, obviously it's important. You are a massive part of this response. Right now, the best way that you can help is to figure out a way to help with the shelter management needs within Florida and other states as they pull the evacuation triggers. So there's a couple websites. There's volunteerflorida.org and nvoad.org, nvoad.org. Right now, the mission where we need citizens and neighbors helping neighbors is in the shelter management mission. So please find a way to get involved in that way. And then after the storm, folks, it's all about setting expectations. The power is going to be out for days in Florida, if not longer in some cases, and we're going to need neighbors checking neighbors, after this event as well. So with that, we will open it up for any questions. Yes, sir.
Dave Shepherdson from Reuters. 2 questions. How many people do you anticipate having to evacuate southern Florida at this point?
Jeff, do we have numbers on any?
We don't. We have shelter capacity is full, and is rising, but we don't have.
Okay. So some of the numbers. So what we're most concerned on is not just necessarily the number of people. One, we need the people to listen to their local officials. But when we see evacuations taking place, what we try to do is break down the number that are going to need mass care support. And some of those numbers are well over 100,000 people in shelters for this event. That number, that's a moving target, and it just depends on what type of activity takes place today. But typically, if you ask 100,000 people to evacuate from a coastal county, you can see a shelter demand of 5 to 8%. And you know, out of those coastal counties or out of that number. So you can imagine how hard it is to it's difficult to accurately project.
What's the status of the disaster relief fund? Is there any money left in it today? And if Congress doesn't act, you'd be able to.
So the emergency appropriation went through yesterday, as I understand it. So we're okay. That's, you know, we're operating, and as I've been saying, we're not going to let money and paperwork get in the way of us leaning forward. This is a life safety mission, and we're not going to stop. So the Congress knows exactly what the job was that needed to get done. They worked very closely with the White House as well as Homeland Security to do it. And yesterday they passed an emergency appropriation. Yes, sir.
Reporters on the ground in Florida are running into a lot of people who are in the evacuation zone but are saying, hey, I've been through a lot of hurricanes before. I'm going to ride this out. There's even some prominent voices like conservative radio host Rush Limbaugh who's saying this is fake news. The threat is overblown. What would you like to tell those people right now?
Nobody in Florida that I know has ever experienced a Category 4 or 5 storm making landfall. The nation has only seen 3 Category 5 storms since 1851. Labor Day storm of 35, and then you had Camille in 69, and you had Andrew in 92. And Andrew was a very, very small, compact Category 5 compared to what we're seeing here in Irma. Even though it's, you know, each Category 5 storm is tremendously different because of the maximum radius winds and the elements that it brings with it. So I can guarantee you that I don't know anybody in Florida that's ever experienced what's about to hit South Florida.
So they need to get out.
They need to get out and listen and heed the warnings.
Jeffrey Cook from ABC News. Can you talk about the differences and the challenges between Harvey and Irma and having the preparedness on the preparedness?
So Harvey was a different storm. Harvey was a rapidly intensifying storm that didn't have good steering currents. You know, and what that means is that one, the intensity came up very quickly. It made a real impact into Port Arthur and Aransas, Texas, and basically moved up to the state, lost its steering currents over 5 days, and stalled out, which means copious amounts of rain. This storm is different. The key here is when it starts to slow down and make its turn north, and then we'll have a better idea of the true impacts that we're going to see in Florida or in the southeast. But the bottom line is that the steering currents and the model guidance is very clear on this one, that it is going to basically come up the Florida Peninsula, and there is a lot of certainty in this forecast. We didn't have certainty in Harvey.
Nicole Stangus, CBS News. Obviously, flooding is a big concern for evacuation areas, and perhaps this is for Secretary Price, but is there a significant health concern with some of the flood water and water contamination?
Well, absolutely. Anytime you have standing water for an extended period of time, then there are resultant challenges that occur. The way that we manage that is to test the water, make certain that we know what's in the water and what the health challenges are. I mentioned that we'd seen over 5,000 individuals in our medical stations pursuant to Harvey, and many of those individuals had because of the exposure to the water, had challenges, whether it was rashes or whether nausea or vomiting or diarrhea and the like, because of the exposure to the water. We're working on getting tetanus vaccination to individuals who were both in Harvey and any flood challenges that exist. The biggest challenge from a health standpoint in these storms, however, is making certain that those folks with chronic illnesses and chronic diseases are able to hook back up with their providers. When you get displaced from your pharmacy, when you get displaced from your doctor or clinic, and for a period of time, then those chronic health challenges become more acute, and that's the biggest challenge that we see over a period of time.
Additional questions?
Thank you all.
All right. Thank you.